Everyone, thank you for joining us. My name is Brad Woodhouse. I am the president of Protect Our Care. We have a great lineup for you today. I wish that we were not here. I wish we didn't need a rally to protect Medicaid and to stop the cuts to Medicaid that have been proposed. But that is where we are. And so just to give people just a quick level set. So we're here because Republicans in Congress, and of course the president himself, want to slash Medicaid. We've been here before. They've wanted to slash Medicare. They've wanted to slash and end and repeal the Affordable Care Act. But so you might ask, why are they trying to slash Medicaid today? And it's very clear. And if you look at the resolutions that have been passed, particularly the one in the House, it says explicitly they have to cut spending so that they can cut tax cuts. They can provide tax cuts to the wealthiest Americans in this country. That's what they're going to do, or that's what they're trying to do. That's what we're trying to stop. And I'm so pleased to be here today with advocates and so many senators who are on the front line of this fight. And I want to start by introducing a true champion, a healthcare champion. I mean, someone who's been in this fight for so long, beginning way back in the 80s in the House and all the way up until today. And that is the former and future chair of the Senate Finance Committee, the current ranking member of the Senate Finance Committee, Senator Ron Wyden of Oregon. Senator?
Brad, thank you. And thanks for the terrific work that you all did to put this together. It is just critical that Americans stand up and make sure their elected officials are fighting Musk and Trump's effort to stomp all over our Constitution. Now, I'll start by saying political change hardly ever starts in Washington, D.C., and then trickles down. It's almost always the other way. It starts at the grassroots and goes up. And to drive the point home, last night I hosted a tele-town hall with 5,000 Oregonians who decided they wanted to talk about these kinds of healthcare issues and other priorities rather than going to the alternative reality program that you saw on the floor of the Congress. And I can tell you last night, I heard loud and clear from Oregonians that they are terrified about what Republicans are planning for Medicaid. And as we begin our discussion, and I see my finance members, terrific people, I see Senator Warnock, I see Senator Hassan, I thought it was striking that last night, Donald Trump pretended that Medicaid didn't even exist. You never heard it mentioned once. Now, that's a pretty odd story when you listen to my guests who came last night. Patty and her daughter Katina from Tigard, Oregon, were here speaking out from my office, and they depend on Medicaid to help with Katina's medical expenses. Medicaid helps Katina thrive in her community, and she's living with Down syndrome. The family volunteers their time to advocate for families, by the way, living with a disability across Oregon. They know that these cuts to Medicaid are going to force agonizing decisions about care for families and state Medicaid programs alike. So before we get into the particulars, I particularly want to thank you for making sure that everybody on this call understands how important it is to call your representatives, show up at state houses, coordinate with other advocates, and join other communities in your area to speak out. Right now, the Republicans are debating a budget resolution that will set the stage for massive cuts to Medicaid. And they're telling the key committee, and you know this, Brad, to cut almost $1 trillion from Medicaid. I was on that committee, and I can tell you that there's no way on earth that they can go about their business without hitting Medicaid very hard. They're supposed to hit a target of close to $1 trillion. You can't get there without hammering Medicaid. And the Republicans know what they're doing is unpopular. That's why they're canceling town hall meetings. They're using gimmicky messaging to dodge tough questions. And my colleagues on the Senate Finance Committee know that we always hear that the Republicans aren't going to do anything to Medicaid. Well, the reality is they're just hiding what they're doing behind a curtain. And my view is that they're just hoping that we'll let our guard down so that down the road they can spring these cuts and we're going to block them. Our job is to put Republicans on notice and communicate the harm that the cuts that will produce. That's why your work is so important, Brad, and it's coming at a time when, as I saw last night, the American people are watching. Working families across the country know that it'd be a huge mistake to let Republicans get away with cuts to Medicaid that rip away health insurance or essential benefits. Unfortunately, in the House of Representatives, as I just touched on, you've got the Republicans talking about major cuts that are going to jeopardize care for kids, low-income seniors, and Americans with disabilities who count on home care to live with dignity. This is very similar to a fight that played out a few years back when Republicans tried to appeal the Affordable Care Act and undermine Medicaid in 2017. Back then, concerned Americans like you turned up the heat and made it clear to Republicans and their constituents that it would be a mistake to go forward with these cuts. I'll close by saying that I think all of us who are making this case this afternoon, Brad, understand that it's unconscionable to look at hurting kids and seniors and those with disabilities to finance a tax cut that will disproportionately benefit the people at the top. So we got big fights to come. I'm counting on everybody working with all of us to make sure that we push back successfully as we did in 2017. There's a lot on the line, and I think our guests are going to really enjoy the senators who are participating. And we've got two terrific members of the Finance Committee on my screen already. So in the parlance of the Senate, Brad, I'm going to yield the floor to my terrific colleagues.
All right. Well, thank you, Senator Wyden. And let me just say that without a doubt, every senator joining this call, every Democratic senator in the United States Senate is a healthcare champion. There's no bigger champion than the person I'm getting to introduce next, someone who's been in the trenches for years and years and years, not been in the Senate that long, but in the trenches, helping families, helping constituents, helping all types of people, and who has made a major impact in the United States Senate, helping address the maternal mortality crisis, passing legislation for a $35 insulin cap, and now fighting like hell to protect Medicaid, the great senator from the state of Georgia, Raphael Warnock.
Thank you so very much, Brad. It's great to be here with you. So deeply honored to be with my colleagues. I couldn't have a better chair of the Senate Finance Committee than Ron Wyden. Grateful to him and all of my colleagues, and grateful to the work that Protect Our Care continues to do. That work could not be more important than it is right now. Shout out to all the members of SEIU. Thank you all for continuing to bear witness to the best in the American tradition, even as we are witnessing those who are trying to advance the worst. I was excited to recently join the Finance Committee under Senator Wyden's leadership. And one of the reasons why I wanted to be on the Finance Committee, not only as a senator, but as a pastor, quite frankly, is because I think a lot of people look at a budget as a fiscal document. And it is a fiscal document, to be sure. But a budget for me is more than dollars and cents. It's more than numbers. A budget is more than a fiscal document. A budget is a moral document. Show me your budget, and I'll show you who you think counts and who doesn't. What you think matters and what doesn't. Show me your budget, and I'll show you your priorities, regardless of what you say. Show me your budget. I think, we say in street parlance, put your money where your mouth is. And as we look at this budget, this effort that the Republicans are trying to put through, you would have to say that if their budget and if their ideas, giving a tax cut to the wealthiest of the wealthy on the backs of the poorest of the poor, struggling, working families, if that kind of budget were an EKG, it would suggest that America has a heart problem and is in need of moral surgery. And so as a voice for the people on the Finance Committee, as a voice representing the people of Georgia, I intend to keep trying to perform moral surgery, to direct our heart towards the highest and the best in the American tradition. We're always better when we center ordinary people, hardworking people. And we always lose our way when we get caught up in the politics for politics' sake. How are the politicians doing? Which party is in the majority? Who's in the minority? Who's up? Who's down? Who's in? Who's out? Who cares? Who cares? I think that's what ordinary folks are saying, sitting around their tables all across Georgia and all across America right now as they're witnessing those who are trying to take their health care away, as they are literally witnessing folks trying to take their Medicaid away. And so let me just take a moment in my time just to tell you a story. Whenever Jesus wanted to shake us and push us towards the better angels in our nature, he usually did that by telling a story, a parable. But this is a story of a young lady that I have gotten to know. She's in Dalton, Georgia. Her name is Heather Payne. Heather Payne. Heather spent her career taking care of others. She's a traveling nurse in emergency rooms all across the country, a traveling nurse. And she did that work for years, even through the terrible pandemic of COVID-19. And she often did not have health care for herself because she made too much money to qualify for Medicaid. But the only coverage options available to her cost anywhere between $500 and $1,000 a month. I want you to think about that painful irony. A healthcare nurse who cannot afford healthcare. That's the America we live in. And so about 2.5 years ago, Heather noticed that something was not quite right in her body. Something was going wrong. She couldn't quite put her finger on it, but she knew something was wrong. And because she didn't have health care, sometimes she had health care, sometimes she didn't. She was a traveling nurse. She didn't have health care at the time. And so she literally kept working through the pain, saved up for several months so that she would have enough money to pay for an out-of-pocket visit to a neurologist who told her she had already had a series of small strokes. Now Heather is putting off serious medical procedures that she needs because she cannot work as an ER nurse anymore. And she is still waiting to get approved for disability so she can get Medicaid coverage. Today, Heather is in school training to become a nurse practitioner so she can get back to helping patients. But even her full class schedule does not fulfill Georgia's onerous and bureaucratic paperwork requirements. In a time when healthcare providers in rural parts of our state are in short supply, the state of Georgia will not give her the care that she needs to get healthy so she can return to work. I think it's wrong that in the richest country on earth, we don't want to lower the cost of healthcare for people who worked hard serving our community and keeping us healthy. Georgia is one of 10 states that is yet to expand Medicaid. Our governor has put together his own program that clearly is not working with its onerous work requirements, a lot of bureaucratic red tape. He has spent more money on the administration of the program than on enrolling people. We've got 600,000 people in the healthcare coverage gap. He's covered a whopping 6,000 people. And so as we take stock of what Republicans are trying to do, we must be very clear. They are just trying to pass a huge tax cut on the backs of the poorest of the poor. It's not right. It's not fair. And we have to stand up at a moment like this. I believe in hard work. I was raised by parents who had a serious work ethic that they passed on to me. But Heather Payne doesn't need anybody to encourage her to go to work. She needs a path to health care so she can get back to work. And so let's stand up in this defining moment in our country. Let's actually work for the people who sent us here the last time we were in the midst of a reconciliation process and the Republicans were in charge. Guess what, Brad? I was here fighting for health care then, but I was not in the Senate. I was a pastor, still am a pastor, and I came here as an activist while they were doing that last reconciliation bill under Republicans to pass a $2 trillion tax cut back then in 2017 and 2018. And I came here and I was arrested as an activist fighting for health care. Well, nowadays, I'm actually in the room with Ron Wyden and so many others. I've translated my activism and my agitation into legislation, my protests into public policy, and I intend to hold them accountable. Keep the faith.
All right. Thank you, Senator Warnock, and thank you for being in the fight. Thank you for being in the fight back then. We don't need you getting arrested now, but thank you for all of your service.
If necessary, I'll do it again.
I'm sure you will. I'm sure you will. Thank you so much. I just want to say that story. We're all over the country. Protect Our Care is, and we hear those stories all the time. We'll hear probably some of those stories as we go on through the program today. So thank you so much for sharing that. With that, I want to move on. I want to introduce U.S. Senator Maggie Hassan. Maggie Hassan, as everybody knows, is from New Hampshire. She came in the Senate in 2016, and her service has been characterized by fighting for health care, doing it in a bipartisan way, fighting to combat substance use disorder, fighting for relief in the COVID pandemic, fighting to end and pass legislation to end surprise medical billing. She is from the Live Free or Die state, but she understands you can't live without access to affordable health care. With that, I want to turn it over to Senator Maggie Hassan.
Oh, Brad, thank you so much. And to my colleagues, Raphael, and to our chair, Ron Wyden, thank you guys and all of my colleagues who are on this call. More importantly, to Protect Our Care and SEIU, I am really, really grateful for all the work that you are doing all over the country to really shine a light on this fight and what it means to the American people. Because what we know, of course, is that President Trump and the congressional Republicans are pushing a budget that would pay for tax breaks for corporate special interests and billionaires at the expense of Medicaid, effectively ending Medicaid as we know it. It's wrong, it's dangerous, and it's going to be devastating to our people, our communities, and our economy. Medicaid serves tens of millions of people around the country. I think you all know that. People who matter and people who depend on Medicaid so that they can get the health care that they need and participate fully in their communities and in the workplace. So in New Hampshire, just to give you a snapshot, Medicaid covers about 180,000 people. We're a state of 1.4 million. Nearly 90,000 of the people on Medicaid are children. Over 15,000 are people with disabilities, and nearly 10,000 of our seniors depend on Medicaid for their health care. And what we know is that the Republican budget the proposal threatens to cut up to one third of Medicaid's federal funding. And in my state, that could mean as many as 60,000 granite staters, including nearly 30,000 children, would be cut off from their coverage. Nationwide, that adds up to about 25 million people across the country losing their coverage, including about 10 million children. I was governor of New Hampshire when we expanded Medicaid, one of the things we were able to do after the Affordable Care Act passed. And we did it with Republican support. And we did it in a bipartisan way because even though we don't agree on everything, we did understand in New Hampshire that we're all better off when people are healthy. When more people are healthy, when they're free from chronic illness or addiction, more people can work. Our economy is stronger. And that is one of the things that I think is really important for people to remember is that Medicaid is a key point of access for people who have addiction. Last night for the president's joint address, I brought to the address a constituent of mine who herself got into recovery from addiction because Medicaid made residential treatment accessible for her. She now does peer support for pregnant women and moms who are in recovery themselves, services that are covered by Medicaid. That's who we are really working to help, because in a country like ours, and the greatest country on earth, there is nothing American about turning our backs on our neighbors. Instead, we know that everybody should be free to get ahead and stay ahead. This is a country where everybody counts. That's what democracy is all about. So just a couple of more points. If this budget passes, it will be the end of Medicaid as we know it. And I think it's really important, as you are all fanning out, doing your organizing work, raising your voices, that you really tell the stories of the people who Medicaid helps. More people will get sick with these cuts. Our economy will be weakened. Families will be hurt. And the American people deserve to know why supporting a child with asthma or making sure that somebody who's struggling with addiction gets treatment, why that should be sacrificed to pay for another tax break for a billionaire. That's really what this is about. I will say that in my state of New Hampshire, what's really important to people is to understand the impacts of this coverage, these dollars, on real people's lives. So I know you already do this, but I will encourage you all to talk with your friends and neighbors about your friends and neighbors. Tell these stories, lift them up, because that is what's going to make the difference. It is really important for people to understand that the Republican plan right now is to take Medicaid away from people who need it, who can't get health care without it, also that they can pay for tax breaks for corporate special interests and billionaires. So it's really, really important. You all know this. You've done it before. We're going to do it again. Let's stand up for America's kids, for people with disabilities, for people with chronic illness, for people who are trying to get treatment so they can get back to work, for people with disabilities and our seniors. Let's do it together. Let's push back, and let's stick to our core values as Americans about what's really important, what our priorities really are. Thanks for having me, everybody.
Great. Senator Hassan, thank you so much. I mean, as I think you are articulating, I mean, 72 million Americans benefit from Medicaid, and it is red states, it's blue states, it's purple states, it's Trump voters, Harris voters, Biden voters, Clinton voters, you know, I mean, it's everybody. You know, it's perplexing. And we've done polling and seen polling, and I'm sure Senator Baldwin knows this, but you know, that demonstrates that this is a political loser for, you know, for Republicans. But one thing Republicans have an insatiable appetite for, and that's tax cuts for the wealthiest of Americans, the wealthiest constituents, and the wealthiest campaign contributors. So that is what we're fighting. But thank God we're fighting it with people like our next guest, someone that we cherish. We've been in Wisconsin for as long as I can remember as a group, Protect Our Care. And we have always felt like one of our best champions in the United States Senate is Senator Tammy Baldwin. She has been there in the fight. She's been there, you know, to pass the ACA, to defend the ACA, to protect the ACA, to defend Medicaid. She was on the Hill with the rest of us trying to fight RFK Jr.'s nomination, which is turning out to be the disaster that we predicted. And I'm just so glad to have her in our corner. With that, I want to turn it over to Senator Tammy Baldwin, the great state of Wisconsin.
Brad, thank you so much for having me and for bringing all of us together. It's exciting to see how many people are participating in this virtual press conference, this virtual rally to protect Medicaid. And I want to thank Protect Our Care and the Service Employees International Union, as well as my colleagues, our leaders who are out front on this issue. I'm just really honored to join you. And so you've already heard from those who have done the scene setter for this rally, the numbers. You know, there are so many Americans who would be impacted by deep cuts to Medicaid. 72 million Americans, or more than that, rely on Medicaid for healthcare, 8 million seniors, and almost a third of all children. But I want to take time to tell you a couple of stories, but including the guests that I brought to join me last night at the State of the Union address. Her name's Renee. And Renee has stage 4 metastatic breast cancer. And it has metastasized to her brain, to her lungs, and to her liver. And Renee relies on Medicaid for her cancer treatment. And I might add, she also relied on Medicaid for her cancer diagnosis. But today, she relies on it for her treatment. And without it, she would literally be forced to either ration or forgo care. And she's really terrified, as you might imagine, on the topic of what cuts to Medicaid would mean to her and her family. She told me if Medicaid went away, that she would have a couple of very basic choices in front of her. One would be to draw on she and her husband's life savings, their retirement savings, to actually pay for all of the care that she needs and run the risk of bankruptcy. And the other set of options would be either to ration her care or to stop treatment altogether. And those aren't real options. I mean, it's just an impossible choice. And I tell you Renee's story because we're not just talking about numbers here. Though the numbers are staggering when we do talk about them. But we're talking about Americans. We're talking about Americans like Renee, who rely on Medicaid for life-saving care. And we're talking about children who need Medicaid in order to see a doctor. And we're talking about rural hospitals that without the reimbursement they get from Medicaid for the patients that they see who are on Medicaid, would literally have to close their doors or close parts of their operations down and leave millions across this country who live in rural communities without any options, oftentimes for emergency care or even just regular checkups nearby. And we're talking about people like my own mother. So my mother relied on Medicaid towards the end of her life to help pay for skilled nursing care. And she was just like 6 out of every 10 residents in nursing homes who do count on Medicaid to make sure that they can get the care that they need. Once again, as we outline the devastating impacts that the Republican plans contain, we are left with one basic question. Why would Republicans want to take away your health care for children, for healthcare from seniors or from rural communities? Well, as Brad just said, the answer is pretty simple. They want to give new tax breaks to billionaires. That's it. They want to take away your health care to pay for tax breaks for Elon Musk and Donald Trump and other billionaires. They're coming after your health care so that the ultra wealthy will never have to pay their fair share. And they know this plan is not popular, and that's why they keep lying about it. So what sort of lying are they doing? I'm going to tell you about it, but you don't need to be a math major like I was, and I was a math major, to figure out that this Republican plan, which is being advanced without any Democratic support. This plan that's endorsed by the president calls for nearly a $900 billion cut to Medicaid. But what are they lying about? What are they saying? They're saying that they're going after fraud, waste, abuse, and they keep saying that, which, for the record, I and every one of my colleagues support rooting out. But Republicans, if they get their way, we're going to see some deep, deep cuts that go well beyond efficiency or cutting out waste. Their deep cuts would literally devastate the healthcare that over 72 million Americans rely on, along with countless nursing homes and rural hospitals. So I am proud to be fighting alongside all of you, joining this virtual rally to stop the Republicans from stripping away healthcare from Wisconsinites like Renee, like so many others, all to pay for their billionaire tax breaks. And I'm really confident that together we're going to put up a fight and win this fight and protect Medicaid. And so Brad, I'm going to hand it back to you, but thank you again to everybody for taking the time to be a part of this rally.
Great. Thank you, Senator Baldwin. Thank you for laying out the stakes in this fight. And thank you for saying what you said right there at the end, that we are going to win, because I do believe that we are going to win. We have a lot of Republicans, particularly in the House, that are on the run. And that's one of the reasons they're doing what you said they are, which is lying about what the House resolution did, trying to, hide behind the fact that the word Medicaid wasn't mentioned, even though all the cuts would come out of the committee that has jurisdiction over Medicaid. And with other things off the table, Medicaid is why they rob banks is where the money is. Why do Republicans rob Medicaid? It's where the money is. With that, I want to go to our next great senator, someone that we have Protect Our Care has worked with a lot over the years, someone who is a true healthcare champion. One of the things he really took on was the fight to lower drug costs by allowing Medicare to negotiate lower prices. He is the great senator from Vermont, Peter Welch. Senator Welch.
Hey, thank you. Thank you. It's so good to be with you and with my colleagues. And I think I saw Senator Merkley in the waiting room, who's been a great champion for all of us. Pardon me. I'm not going to repeat what Senator Warnock and Senator Hassan and Senator Baldwin said about how important it is on Medicaid for us to have that, because I can't do better than what they just presented. I just want to talk a little bit about what's going on and how it's so profoundly different as I experience it than what I've experienced here in DC in nearly 20 years. Last night was different. And it was different in the sense that you had a president who feels very empowered and very authorized to basically go it alone and make himself the rule of law. What he's been on since January 20th, in my view, is a lawless rampage. And that's a pretty extreme term, but I think it's accurate. He immediately started out by essentially interfering with the power of the purse that is the signal authority of the Congress. He then, with Doge, completely unelected person, no authority other than what's delegated to him by Congress, or pardon me, by the president, is firing people, where the cover is that it's about waste, fraud, and abuse. And as if there's any of us who are in favor of waste, fraud, and abuse. But it's not about that, because if you were trying to get programs to run more efficiently, you would examine the program first. You'd kick the tires. You'd see how it was performing and achieving its mission, and you'd make adjustments based on that. And you might make some changes in the staffing. And that might be some places you don't need staff, and it might be some places you need more. But what they're doing at Doge is just wholesale sending out emails, firing people. And it's very painful for the folks who get that email. It's very deceptive, because oftentimes it's asserted they were not performing their job when they just got a performance evaluation on top of 10 before it that said they're outstanding. And what you see is that Doge and Musk are basically claiming savings by upping the body count. If they can fire you, then they can claim savings. And they'll figure out afterwards, if they ever bother to figure out at all, how that will undermine the basic functions of what's going on. So you've got this president who's acting unilaterally. He's doing impoundment which is, of course, not spending the money that was authorized by Congress for specific purposes. And the last president who did that was Nixon. And then Republicans and Democrats resisted that and ultimately prevailed. And the reason they did is that even though even back then there were significant political differences between Republicans and Democrats, there was an institutional responsibility that both our Republicans and Democrats embraced, and that was to maintain the independent responsibility and authority of Congress as a separate and co-equal branch of government. And that's important, not just in the abstract, it's important to prevent the excessive accumulation of power by the executive. And it's really essential to the well-being and sustainability of our democracy. Trump is attacking that directly. And regrettably, you've got Republicans who are acceding to that and rolling over. And the next step will be whether the administration, in the wake of a potential Supreme Court ruling prohibiting their conduct, do they comply or do they disregard it? And there's ominous signs there with what J.D. Vance has been saying, which is essentially let the court enforce it. So that's one thing, the backdrop. The second thing is that just the atmosphere in that room was different than I've ever heard it. There's always been there's always been real divisions between our parties. And oftentimes there's been raucous State of the Union behavior by both sides. But I've always experienced that in the past where there's at least some underlying amount of levity and an awareness that we have political different points of view, we're acting out on it, but there's an understanding that we have a function and a role to play, and that we, despite our differences, have some mutual respect. What I saw last night with Trump starting out and really just vilifying gratuitously the Democrats, vilifying President Biden. I mean, who has ever heard of a State of the Union speech where the president who is giving the address spends a lot of time nursing old wounds and grievances against the person that was before him? It's just really pretty astonishing. But what I saw that was different was this anger. And I saw both among my Republican colleagues, well, particularly the House members. It wasn't so bad in the Senate, but even among the cabinet, who were like devotional to Donald Trump, even though they knew better. And what's so dangerous about that is that you've got folks now that are totally endorsing things just on the basis of Trump asserting that this is what he wants to do. A good example of the tariffs. Those tariffs are crazy, okay? Mexico, Canada, we're just going to be hurting Vermonters with those and a lot of other people around the country. And a lot of my Republican colleagues know that, but Lord Trump has pronounced them to be the policy and they're going along with it. Now, the other area, of course, is on fiscal policy. And this is where Medicaid comes in and where my colleagues, I'm in agreement with them, what the ultimate objective is. But what's so astonishing about it is that when all the things that we've been saying, that Tammy talked about, that Maggie talked about, that Reverend Warnock talked about, how it affects folks in their state. And in Vermont, it's like 2 out of 3 seniors who are in a nursing home, they're supported by Medicaid. And all our kids from lower income families supported by Medicaid. Our community hospitals that provide services to folks in rural communities. Without Medicaid, they'll go out of business, and that means no access to healthcare. And what's true that I just said is true in Georgia, it's true in Wisconsin, it's true in New Hampshire, but it's also true in Texas. It's also true in Indiana. It's also true in Kansas, all states that have Republican senators. So these senators are hearing from their constituents who are on Medicaid and from their community hospitals that depend on Medicaid in order to be able to deliver their services. They're hearing the same thing that Maggie is hearing and that I'm hearing, that Tammy's hearing, and that Raphael is hearing. Yet they're willing to just follow the party line because that's what Trump is demanding. And of course, what he is demanding, as my colleagues have pointed out, is that first, last, and always, we've got to cut the taxes for the billionaire class. That's literally what it is. It's that simple. And they want to pretend they're going to, quote, pay for it, but the way they're going to pay for it is to eviscerate not only healthcare, but that obviously is so essential to the well-being of people and their security that they have access to healthcare. They're going to get rid of anything and everything they can. So that's why 7,000 veterans have been fired, 7,000 Social Security workers, folks who answer the phone and provide answers to questions, they've been fired. It's why the government is stiffing farmers that they had entered into contracts with, where farmers were going to put up solar panels for cleaner energy, or they were going to do a riparian safety zone to protect clean water. And the farmers put the money up on the promise of getting repaid. And the Trump administration DOGE is telling those farmers, no, we're not going to pay you. So this is a level of cruelty with a cruel policy cruelly implemented that I've never seen. And the healthcare, which we're focusing on, is the biggest grab of money. It could be up to $800 million with the maximum infliction of pain on people who are powerless otherwise. And it's why all of us are so united with you in doing every single thing we can to protect Medicaid, but also to get the story out about what's going on in the Trump world. So I'm glad to be with you, and let's hang in and keep working together until we win this.
Senator Welch, thank you as always. Informative comments, and you really do have the fight in you, and we're so glad that you could join us. With that, I want to turn it over to Senator Chris Van Hollen. Now, Senator Van Hollen is dealing with, as much as almost any senator in the country is dealing with the fallout of what is going on in this administration, the DOGE disaster, the NIH cuts or not cuts, or what's going on with all that, what Elon Musk is targeting in terms of federal employees in this area. But notwithstanding dealing with that, Senator Van Hollen's a healthcare champion. I'll never forget the leadership he showed in the House of Representatives, one of the leaders in that effort to pass the Affordable Care Act. He's fought like hell to protect it. He understands the importance of healthcare, understands the importance of delivering healthcare, understands the importance of Medicaid. So, Senator, with all you're dealing with, thank you for joining us today. Senator Van Hollen.
Well, Brad, thank you. Thank you and the entire team at Protect Our Care. Thank you to all the folks at SEIU and all the Americans who are rallying at this moment to protect our care and to protect our Constitution and protect our country. What we're witnessing in real time is the great betrayal. Donald Trump on the campaign trail said he was going to focus on lowering prices and costs for Americans around the country, lower grocery prices or rents. He said he was going to do that on day one. Instead, grocery prices are going up, rents going up, home prices are going up. But what he's cutting is not prices, but what he's planning to cut are services that are very important to Americans across the country, as well as cutting deeply into health programs that are important to Americans across the country. And he's doing this in two ways. First, he set up the illegal Elon Musk DOGE operation, and they are taking a chainsaw, literally, you saw Elon Musk very proudly wielding this chainsaw to important government services. And they are doing it not for greater efficiency. I want to be very clear, right? If you're in favor of greater efficiency, you don't start by firing the inspector generals, whose job it is to look out for waste, fraud, and abuse. You fire the inspector generals if you're laying the ground for more corruption going forward. And what this is rigging the government to do the bidding of people like Elon Musk, very powerful people, at the expense of other Americans that the government is supposed to serve. So that's what's going on one front, cuts to those important services. And then, of course, on the other front is their plan to cut deeply into health programs like Medicaid in order to pay for and finance tax cuts for the very wealthy. Again, people like Elon Musk. Now, last night, we were all witness to just a torrent of lies. So many lies. It's hard to keep track of them, but it is important to focus on some of the biggest lies last night. One of the big ones, of course, was the lie regarding Social Security. And when it comes to Social Security, the president made these false claims about how we're spending, hundreds of millions and millions of dollars sending Social Security benefits to dead people. This is just untrue, but it shows where the president's mindset is in terms of coming after retirement programs. And we know that the same will be true when it comes to healthcare programs. So don't believe Donald Trump when he says, and I'm quoting here, that he would love and cherish Medicaid. What we've learned from Donald Trump is that he says things like that at the same time that he's working to sabotage them, or his cronies or proxies are working to sabotage them. And we know that that's happening right now on Capitol Hill, that the Republican plan, their framework for what we call the budget reconciliation process, is intended to target Medicaid to the tune of about $880 billion. That's huge. At the same time, we see what RFK Jr. Is doing over as Secretary of Health and Human Services. Now, we fought very hard to defeat RFK Jr., but Republicans in lockstep, with few exceptions, voted to install him there. And what we're seeing right now are the consequences of RFK's dangerous statements about vaccines. And of course, we have a measles outbreak in Texas. And that's what happens when people hear these falsehoods and they hear these outright lies. It puts the country at risk, as he's doing. So at the same time, and because this is coming at us from multiple fronts, the Trump administration has illegally fired a number of civil servants at CMS. That's the agency, of course, that helps process Medicare and Medicaid claims. If you end up getting rid of all those people, you don't have people to process them to begin with. Now, I will say that we are fighting back in the courts and in Congress and in communities around the country. We had some good news today from the courts or from quasi-judicial entities, including the Merit System Protection Board, which just said that they wanted to reinstate, at least for a period of time, thousands of federal employees who had been fired from the Department of Agriculture. And this is just the first step to getting federal employees reinstated in other agencies where they've been illegally fired, including places like CMS, which shows the importance of fighting back again in the courts, in Congress, and in communities across the country. And that's why this town hall discussion is so important, because what we are witnessing around the country is Americans showing up to town hall meetings and confronting their members of Congress, confronting their Republican House members, their Republican senators with the facts. And what we've seen is Republican House and Senate members don't like to face the truth. And we've seen the videos of them running away or refusing to really answer. And in fact, they just advised Republicans, I think, in the House not to hold any more town hall hearings. So that's an indication that the voices of the American people are making a difference. They don't want to hear the truth, but we need to keep telling the truth. And so I think that's why these kind of gatherings are so important going forward. Now, when it comes to this great betrayal, one of the main things that as we've talked about, that they want to target or our healthcare programs. And I know my colleagues have talked about how important Medicaid is to providing healthcare to people in their states. And the same is very true, of course, in my state of Maryland, where the Medicaid program and the Children's Health Insurance Program cover 1.5 million families and kids. So that's 20% of the population in Maryland, 1 out of every 5 people. When it comes to providing help for birth of babies and helping their moms, 2 in 5 of those births are covered by Medicaid. 1 in 3 kids covered by CHIPS or Medicaid. 5 out of 8 nursing home residents in my state of Maryland, 5 out of 8 are covered by Medicaid. Without Medicaid, these frail, vulnerable individuals, where do they think they're going to go? And it's also true, of course, for people with disabilities. 1 in 3 people with disabilities in the state of Maryland depend on Medicaid. So they're not cutting waste, fraud, and abuse. We're all for finding savings through cutting waste, fraud, and abuse. What they're doing is cutting benefits directly. And the reason I know that they're prepared to do that is that in the Senate Budget Committee I serve on, I offered an amendment that said, okay, as you think about doing these tax cuts for rich people, at least tell us and tell the American people that you're not going to cut Medicaid. And they refused to vote for that. Same thing happened on the Senate floor. And so that's a tell, right? I mean, that's how we know what their plan is. If you look at the basic math of the House budget resolution, what Donald Trump calls the big, beautiful framework for the bill, you know that that's exactly where they're aiming. So
Senator
I
Van
will
Hollen,
close.
Senator Van Hollen, I don't want to interrupt you, but Senator Schumer is trying to
Yeah, well, let me just close with this.
Yeah, go right ahead.
Because I think it's important to close with the success story, which is, and Brad, you were part of this, and so were a lot of people on this call. And it is important to remind people that when they tried to torpedo and repeal the Affordable Care Act, they got it through the House, the repeal. But because of mobilization from around the country, people like all of you on this call, we stopped it in the Senate by 1 vote. Every vote counts, every phone call counts. Thank you all for what you're doing. And thank you, Brad, and everybody who's part of this.
Gosh, thank you so much, Senator Van Hollen, for doing this with all that you have going on. I want to go directly to Senate Democratic leader Chuck Schumer, who is a healthcare champion among healthcare champions, who's fought the lower cost of prescription drugs, fought to preserve the ACA, and he knows how important Medicaid is to the people of America and the state of New York. Senator Schumer.
Thank you, Brad, and appreciate Chris Van Hollen, appreciate all my colleagues who've been on. The only reason I'm a little late here is we had a very good press conference on getting the PRO Act passed, which is another thing that will help working families. So let me first thank SEIU and Protect Our Care. Brad, you do a great job. We've been allies for more than a decade. I want to thank SEIU, particularly 1199, 32BJ in New York, 2 of the strongest and best unions we have. Now, why would someone cut Medicaid? What is motivating the Republicans to do something that is so crucial to the health care in America? I'll tell you why. Everything they do, everything Donald Trump, Elon Musk, and the Republican Party does these days is one goal: tax cuts for the richest Americans. But they have to find a way to fund them. And the number one thing that they have gone after is Medicaid. $880 billion in cuts is unfathomable. And all the cuts in healthcare they're doing is the largest healthcare cuts in America. I want to assure all of the thousands on this call, Democrats are united in the fight to protect Medicaid. It is our number one priority. And when people ask us why are they doing it, we tell them it's just for the awful reason of helping the billionaires get even a bigger tax break. This is dangerous to every part of America. In my state of New York, we have a large rural population. A lot of our rural hospitals, often the largest employers in the counties in which they exist, would close. Hundreds of workers would lose their jobs in each one. They're the biggest employer in so many of these counties. Our community health centers, again, provide good, efficient healthcare. When Elon Musk says he's cutting efficiency and then he cuts community health centers, which are among the most efficient providers of healthcare in the country, for a rural person particularly, but for anybody, you don't have to go to a waiting room in a big hospital and sit there 5 hours and fill out forms. You get good, efficient healthcare right away. They don't care about efficiency. They care about cutting everything, using that blowtorch to cut everything because they want that money from the billionaires, plain and simple. And so they'd close so many of these community health centers and the federally qualified health centers as well. How about nursing homes? So many people, and these are, you know, Medicaid helps poor people, and that's so necessary for their lives, but it also is going to affect a lot of, you know, more affluent people in the suburbs. Their parents are in nursing homes. And now you cut Medicaid by $880 billion. You're not going to have that care. Who's going to take care of these people? Many of them are infirm. Many of them can't take care of themselves. What kind of nation would we be to tell the babies of the world that they're not going to get adequate health care? To tell the elderly of the world and everybody in between? As Brad said, we did this once before. I worked very hard as one of the leaders of the Senate to preserve the ACA. And because of your activity, SEIU, 32BJ, Protect Our Care, you were all there. We beat them back. We can beat them back. With your activity, we will beat them back. We should mobilize, we should protest, and we should have all of the folks who will be affected, the people who work in all our healthcare facilities, the people who are served by our healthcare facilities, should be calling, writing, protesting, picketing their Republican congressmen and senators and say, take your hands off our Medicaid. Take your hands off our Medicaid, particularly in light of the fact that all it's doing is making a lot of rich people even richer. Well, we will do everything we can to have the same success we had in 2017, where I was so proud to be a leader in that fight. We know together we are right. We know together we can win this fight. And so, get to work. Let's roll up our sleeves. There's nothing more important than good health care for the American people. And I want to thank Ron Wyden, I don't know if he's still on the Zoom, for putting together this call along with SEIU and Protect Our Care. I am committed with every atom of my body to preserve Medicaid, to preserve Medicare, and to preserve Social Security, which they're going after. In this case, on Medicaid, it's the last safety net for people who need health care. We cannot take that safety net away. We must not take that safety net away. We are morally obligated not to take that safety net away, and we will do all we can, our whole Democratic caucus in the Senate, to stand with you. Thank you. God bless you. Let's fight the good fight and win this battle.
Senator Schumer, thank you. With all that's going on, thank you for taking the time to join us today. Thank you for being in that fight all the time. Now I want to turn it over to someone who's been very patient, who has stuck with us through this long program, Senator Jeff Merkley of the great state of Oregon. Senator Merkley learned about healthcare. We probably knew a lot about it, but he learned more about healthcare in his home. His wife, Mary, is a registered nurse, and he does see the importance of providing streamlined, affordable access to healthcare for every American. And he certainly understands the importance of Medicaid. And we're so glad to have you with us today. Senator Merkley.
Brad, delighted to be with you. And you've heard the basic themes, but you haven't heard them from me, as the saying goes. So I'm going to try to hit them in a succinct fashion, knowing that a couple of my colleagues are yet to join and are hoping to have their say. The Republican plan is very, very straightforward. Families lose and billionaires win. We didn't really hear an honest conversation in the State of the Union last night. So Let me just lay it out as the top Democrat on the Budget Committee. Here's the way the Republican plan works. It is $4.5 trillion in cuts to the taxes, with over $2 trillion of that going to the very richest Americans. And then you have $2 trillion in spending cuts. And then you have additional $2.5 trillion in more deficit. When you heard last night, all this conversation about balanced budget, what a pile of, what's the polite word for it? Misinformation, let's call it that. Because in fact, the Republican plan drives up the deficits and drives up the debt to the tune of additional 2.5 trillion over the 10 years. If you take the instructions that are in their plan and go into the Energy and Commerce Committee on the House side, Energy and Commerce Committee does two things. Well, one is they are responsible for Medicare, and the second is they're responsible for Medicaid. And I heard the Speaker of the House say, oh, our bill that gives instructions doesn't say what to cut. Well, you don't have to be a genius to figure out that if the committee that's being instructed does two things and Medicare is off the table, then the cuts are for Medicaid. And we've heard that enunciated by any number of our colleagues, recognizing that's exactly what's targeted. So do not be misled by the deceptive, oh, but we just didn't actually use the word Medicaid, therefore how could you accuse us of cutting Medicaid? Well, there's no other way that $800 to $880 billion can go than to cut Medicaid. In my colleague states, they've been noting how important Medicaid is. In Oregon, it's the Oregon Health Plan, to nursing homes, to individuals with disabilities, to those who are in programs to fight drug addiction, and certainly to rural America. No, in my state, it's 1/3 of the citizens are on Medicaid, the Oregon Health Plan. And the percent is much higher in rural areas. And so let's realize this is not a blue and a red issue. If anything, it's a much more important program in our more rural that tend to be more conservative politically. So we're not just fighting for a vision that's best for our urban areas. We're fighting for a vision that's best for our rural areas. And what we saw in Oregon when we expanded Medicaid is that so many folks who got healthcare treatments from our clinics and rural hospitals who could not pay their bill now had insurance and could pay their bill. And the rural hospitals and the rural clinics started adding programs because they actually had more revenue. Well, of course, the reverse is true if Medicaid is cut. And it's a point I really want to hammer home because none of my Republican colleagues want to own responsibility for undermining rural health care. So I encourage you to keep driving that point. So I'm going to just wrap this up on my contribution so you can get to my colleagues by saying this message that you're hearing is the same from every state, that attacking Medicaid is a horrendous idea that does vast damage. And let me note that one of the strategies is to say, well, we'll just add a work requirement. Here's the story. People have to be healthy to be able to apply for work, to be able to continue to work. And therefore, if you cut off healthcare, you lock people into poverty and they can't get into the workforce. So it's an absolutely fallacious, misleading argument. And two states tried it out. Georgia tried it out. And I think, which was it?
Arkansas.
Arkansas. My team is reminding me it was Arkansas. You know, and they did not see an increase in employment. It did not work the way the advocates said it would work and get more people to be able to work. And it's obvious why. If you're not healthy, you can't continue to work or you can't apply to start working. So healthcare should be a right, not a privilege of a job that is such a wonderful job that it has benefits. And that's why we created the Medicaid program to begin with. I'm all in defending this program. And I think you're starting to see that a lot of Republicans are getting cold feet on this. And they're getting cold feet because we're calling them out on it. You're calling them out on it. Folks back home are calling out on it. By the way, veterans are calling them out on it. So this feedback coming from every direction is incredibly effective. Thank you for holding this Zoomland town hall about it. And let's just keep going intensely, because I'm convinced if we do, my Republican colleagues are going to say, you know what, we made a mistake, and we're going to take Medicaid off the table. And that's what needs to happen for the health and welfare of so many millions of Americans, a third of Americans who we want to be able to be healthy, stand on their feet, thrive, have their families thrive. And that would be a beautiful future for all of us. Take care.
Senator Merkley, thank you. Those comments are so poignant, and you're absolutely right. 72 million Americans, nearly half of all children in this country. I hope you're right. I hope that Republicans will say, okay, we're wrong about this. We'll take this off the table, or enough, like we saw in 2017. So thank you so much for that. So I want to go to someone who knows these issues firsthand, who has dealt with these issues as a daughter, as a child, as a caregiver, as a worker. Jessie Balmer is a home health care worker, a member of SEIU Healthcare Illinois. She became a caregiver the way a lot of us do, which is a parent who got ill, and she left college to care for him. And after his passing, continued this work and continued to give people their independence, freedom, and dignity. And I think that is so important. So someone who sees firsthand, Jessie, as you do, the impact of Medicaid. I'll turn it over to Jessie Balmer of SEIU Healthcare Illinois.
Hey, hi everyone. I'm Jessie. I'm a home care worker from Albany, Illinois, and a proud member of SEIU HCII, which is our healthcare local. I had a great opportunity recently to attend an SEIU lobby day in DC a few weeks ago regarding Medicaid and the fight we're currently all faced with. And I would say we had a pretty productive trip, but of course, I'm sure the majority of you know, not every legislator is on our side with this. So we were in Washington giving them a piece of our SEIU 2 cents on the matter and how these cuts would affect not only SEIU members, but all of our consumers that we care for and many other American citizens that don't fit into one of those two categories. We brought fact sheets for each one about their constituents from their individual districts, as well as information from the workforce that experiences these things firsthand. And we talked to a handful of legislators that day that were supportive of our voices on this matter. And we talked to some that maybe just weren't, I would say. And I don't imagine anybody on this call's jaw would drop if I told you the Republicans we spoke to were not too thrilled to see us in our purple shirts that day. But we know, as SEIU, the biggest, baddest union that building has ever seen, that we will not stop showing up, speaking out, and demanding that Congress keeps their hands off Medicaid. I'm so appreciative of the members of Congress who are standing with us and those joining us today, including Senators Schumer, Wyden, Merkley, Baldwin, Warren, Van Hollen, Hassan, Warnock, and Senator Welch. They are listening, and we need to make sure all of Congress is listening. Too many of our leaders do not understand what effects these cuts are really going to have on the people in our communities, and I'm sure the majority of people working in the healthcare field are here because of a personal experience. We heard several of them today. And I know that a lot of our legislators just can't relate to that. I know for me, it was my dad, like was said already. I got a call when I was in college from the hospital in the rural town that my dad lived in, telling me that he was very sick and he was going to need help. And he didn't meet the requirements for Medicaid to have like a private home care agency that I work for now. So I left college to take care of him so he could stay in his home, and I worked home health jobs to get kind of a grasp on the knowledge I was going to need to handle things with him and keep him in his home while he made his transition to peace. After his passing, I stuck with home care because I fell in love with giving our most vulnerable, forgotten about groups their independence, freedoms, and dignity that they could not have without home care back to them. And the Republicans in Congress who want to cut Medicaid are not on the front lines with us seeing the magic that Medicaid does every day. So I take care of an 82-year-old, really sassy blind lady that receives services from the company I work for and Meals on Wheels. She receives food stamps, Medicaid coverage for her prescriptions. She has a heart condition. She has to have it to live. And she lives in a HUD building. So without Medicaid, she would have none of that. And what would happen to her? We know what would happen to her. And that's just one example of a client. So I was in Springfield recently doing the same thing that I'm doing here today, representing home care workers within my union. And that's every home care worker represents typically more than one client. So that destroys an insane amount of lives. And that's just the state of Illinois. That's just our consumers. We know that we have members using the resources Medicaid funds as well. I think I'm pretty qualified to speak on this, so I'll tell you a quick little story about myself. I know we have to get things moving. A few years after my dad passed away, I found out I am also sick. I still am, but I'm doing pretty well. And I didn't have Medicaid either. I had private insurance through my job, and I don't know how many of you have seen a chemotherapy bill, but I can tell you they're not cheap. They are not cheap. I got to the point where the little bit of savings that I did have was used up, and I was having to choose between my rent and my treatments every month. So after so long, things just sitting on the back burner built up, and I didn't have any money left. I had to sleep in my car while I was working full time, and eventually I was able to qualify for Medicaid, and that helped me pay for my treatments enough to have the roof over my head that I have right now. And if we're going to be talking about making changes to Medicaid, we need to be talking about expansion, not cuts. And I know this from experience. It takes one thing beyond our control to completely force a person to need these types of programs. Medicaid changes lives and Medicaid saves lives. That's the message we took to Washington last month. That's been my message since 2019. And I'll continue to push that message wherever it needs to go to accomplish our goals in this fight. And I think our trip to Washington was just the beginning of the big things we're going to be accomplishing with SEIU in 2025. With that, I would like to kick it back over to Brad. Thank you all so much for having me.
Wow. Thank you. I mean, it takes tremendous courage to do everything you've done, and to drop out of college, to care for your father, to go into this field and to tell that story, and to travel to Washington and tell that story. And so if you want to come to Washington and be here for the next few months in this fight, I got a room for you. We can put you up. But I know you have to do the good work that you're doing. So thank you. That was tremendous. All right, I want to turn it over to someone else who is in this fight, someone that Protect Our Care works with, an organization that Protect Our Care works with. Jamie Worker is the Director of Public Policy at Caring Across Generations. She's committed, just as we all are, to equity. And I will tell you, healthcare, there's nothing that can help with healthcare equity in this country like having coverage, like making sure that people are covered. What is not equitable in this country is taking away Medicaid from people that are disabled, taking away Medicaid from veterans, taking away Medicaid from children, taking away Medicaid from people in nursing homes, and taking away all of that to use that money to give Elon Musk a tax cut. That is not equitable. And I know Jamie agrees with that. So I'm going to turn it over to Jamie Worker of Director of Public Policy at Caring Across Generations. Jamie.
Thank you so much, Brad. Good afternoon. Again, my name is Jamie Worker, and I'm with Caring Across Generations, founded in 2011. Caring Across works on behalf of family caregivers, disabled people, older adults, and care workers to change the way we support and value care and caregiving. As Republican leadership attempts to advance their goal to pay for more than $4.5 trillion in tax giveaways for the ultra wealthy by taking away critical services that families rely on, there's at least one thing that is clear. There is no way to get to the scale of cuts proposed without taking away essential care that Medicaid provides for millions of families at every stage of life. Care is something that connects us all, and Medicaid plays a critical role in providing this care. Each of us will need to give or receive care at some point in our lives. And this is clear from my own family story too. Medicaid paid for my mom's care during her pregnancy and childbirth, my own birth in Texas. Now I have 2 kids of my own. And when our youngest was 2, his teachers shared with us that they were concerned about his speech development. He was able to receive an early intervention screening for vital services supported by Medicaid. Also, unlike my now 4-year-old and 7-year-old, I didn't have the opportunity to get to know my own great-grandparents. But we recently celebrated the 100th birthday of their great-grandmother. She lives in Indiana with her daughter and is able to live and age at home because of Medicaid. Medicaid pays for a direct care worker to come to their home when my aunt, her primary family caregiver, is at work. So today, Medicaid and the Children's Health Insurance Program, or CHIP, provides health insurance to millions, nearly 80 million, or 1 in 5 people across the country. Medicaid is a critical health program providing care for seniors, children, people with disabilities at any age, pregnancy, childbirth, family caregivers, people who are working multiple jobs and struggling to make ends meet, can't afford health care, or don't receive health insurance from their employer. Medicaid, not Medicare, is also the primary source of funding for aging and disability care, including home and community-based care. This makes Medicaid critical to the well-being of millions of older adults and disabled people seeking to live and age with dignity at home and in their communities with their loved ones. Direct care workers, the personal care aides, nursing assistants, direct support professionals, home care workers, 1/3 of these workers who provide aging and disability care also rely on Medicaid for their own health care. And Medicaid is also critical for family caregivers to have health care when managing caregiving responsibilities and the job they need to pay the bills and put food on the table. That is why every proposal to cut, cap, or make other harmful changes to Medicaid is a threat to the health and well-being of our communities. Medicaid is not a piggy bank, and we must continue to protect our public dollars for care and investments that actually lower costs for families while ensuring that people can access the care that they need without risking everything. Thank you so much, and I'll pass it back over to Brad.
Jamie, thank you. Thank you for the work that you do. I mean, we have a lot of work ahead of us, and I just can't tell you how thankful I am that we're in the fight with you and all the other groups and advocates that are and storytellers like Jesse who are involved in this. So our final speaker is someone who is so special, whose family is so special, whose contribution to this work is so special that she was the guest of the Speaker Emeritus, Nancy Pelosi, last night at the State of the Union address, somebody we work with going all the way back to the fight to preserve the Affordable Care Act, to prevent Republicans from repealing it. Elena Hung is the co-founder of Little Lobbyists, and Little Lobbyists was an idea. It was a movement. It was an advocacy movement that came out of the effort to preserve the Affordable Care Act. It is a family-led organization that advocates for children with complex medical needs and disabilities. Her amazing daughter, Zamora, was born with a number of serious medical conditions and is thriving today as a result of quality care. Elena understands the importance of the Affordable Care Act. She understands the importance of Medicaid. And in addition to advocating for her daughter and her family, she is advocating for families and little lobbyists and little people and all that they mean to this country every single day. And she's not a better partner in this work for Protect Our Care than who I'm ready to introduce, Elena Hung.
Thank you. Thank you so much, Brad. Hello, everyone. Thank you so much for spending your Wednesday with us. Thank you to all the senators who joined us. I am so grateful that we have gathered today to talk about a subject so near and dear to my heart, Medicaid. I know we're running a little bit over time, but that's because Medicaid is so important. Medicaid saved my family, and Medicaid is the reason that my daughter is thriving. So I am here to join all of you to fight tooth and nail to defend it. I am Elena Hung. I am a mom. I'm a caregiver to my amazing disabled daughter, Xiomara, who is the joy of my life. I'm here for her, and I'm also here on behalf of families like mine across the country. Families who are part of Little Lobbyists, a national family-led organization that advocates for children with complex medical needs and disabilities. Now, 10 years ago, my daughter was born with a number of serious medical conditions, and Xiomara has been able to survive and thrive because of the care that she has received. And I want to be clear about this. It's because of Medicaid. The care that Medicaid has made possible. Xiomara is in the 4th grade now. She attends school with her nurse, a nurse who is by her side at all times to care for her medical needs and keep her safe. Without a nurse, without Medicaid, disabled kids like Xiomara would not be able to attend school and would not be able to access their education and learn. And I've often said, you know, there's not a single thing that I would change about my daughter, but there are a million things that I would change about this world so that it would be worthy of her. And the first thing that I would change, the first thing is to ensure that all children have the health care that they need to survive and thrive. And we can do that by protecting Medicaid. Medicaid helps fund home and community-based services. That means disabled children and disabled adults can live in the setting of their choice, surrounded by their loved ones, receiving the care that they need. This is personal. We all have a care story. Now, my story may not be your story, and your story may not be mine, but I know that we all have loved ones that we care about, and we all want to be cared for when we need to be. So let's take care of one another. Let's do that by fighting for the care that we need, by holding our leaders accountable, by protecting Medicaid. So friends, I invite you all, join me and keep speaking out on this. Talk to your friends, talk to your family, talk to your neighbors, your classmates, your coworkers. Talk to the person in line at the grocery store and the one sitting next to you on the bus, the person at the park with their dog. Talk to everyone and ask them to contact their members of Congress. Medicaid is crucial health care. And Americans do not want to steal from disabled children to give tax breaks to giant corporations and millionaires like Musk. And it is up to us to make sure that that doesn't happen. So remember, we have won before and we can win again. So friends, thank you. Thank you for allowing me to share my story and be here on behalf of families like mine. Thank you for being in the fight with us. Thank you, SEIU, and thank you always, always, always to protect our care. I know that I'm fighting the good fight when I'm with you all. So thank you. It's been an honor to be in community with you. Thank you, Brad. Back to you.
Great. Elena, thank you. Thank you for your patience. Thanks, everybody. We still have hundreds of people on the Zoom, and I'm assuming maybe hundreds, if not thousands of people still still on the live stream. So thank you for sticking with us. If you're sticking with us, it's because you know how important this is. We have resources on the live stream. We have a link in the chat for how you can get involved, how you can reach out to your members of Congress. I think there's nothing more important right now than getting, and Elena touched on this, but is getting your friends, your family, yourself, talking to members of Congress, sharing your story. My family on both sides, on my wife's side, on my side, in my immediate family, we have care stories that involve Medicaid. And so get those stories out there, visit that link, stay involved. And this is urgent because this is happening right now. I do also want to thank SEIU. They are a tremendous partner in this. So get informed, get active, fight like hell to save Medicaid. I want to thank everybody that appeared. I want to thank our team at Protect Our Care, the production crew, and everyone else. And if we fight like hell, we will protect Medicaid for this generation and generations to come. So thanks, everybody. And with that, we will close this virtual town hall in support of Medicaid. Thanks, everybody. Have a great day.